everyone. Welcome again to Sihat Beyond the Clinic. Today we've got a very interesting guest with us, Puan Madihah Akmal. She's Pegawai SELPHAC. So SELPHAC stands for Selangor Public Health Advisory Council. So she's a Pegawai tugas-tugas Khas. Welcome to Sihat Beyond the Clinic podcast. Thank you for joining us today, Puan. So before we go further, I would like Puan to introduce herself. First of all, thank you so much, Dr. Vicky, for allowing me to join your podcast. What about me? Okay, so I am in the Selangor State Office, particularly in Exco Public Health and Environments under YB Jamaluddin. I work primarily on public health. So if you ask me anything about environments, I won't have the full answer. But yes, so I work particularly on public health, and in public health itself, we have diverse segments of things that we touch on. So one of it would be mental health. Mental health is actually one of our focuses this year, especially because I think with the issues and the news that come out regularly, especially in Selangor, I think it's quite a pertinent issue that we would like to focus on. So that's about it for me. So when we speak about Beyond the Clinic, SBTC advocates everything that can be discussed beyond the walls of the clinic. Okay, that was why our guest is usually not just healthcare professionals. We prefer to call in experts from all angles. So we've got people from the ground, people working with the communities. We've got NGOs. We've got political partners. Okay, so and we've got people from Public Health Advisory Council today. Okay, so to begin with, not every mental health struggle needs a hospital referral. Sometimes it's just a phone call because it's a minute issue that can be resolved then. However, sometimes it's a 45 minutes away on a Saturday or Sunday morning. With poor access to a counsellor on the spot, this matter can get severe. It can get worse. Okay, so today we're mapping out what actually looks like for somebody who is facing mental health issues in the grounds of Selangor. From a helpline to a walking space to a new peer matching program. So this is why building the ladder of care matters as much as building hospital beds. Okay, so community level mental health infrastructure exists. Okay. Purely because we know that psychiatric or hospital referral is usually the last step in this entire process. And most callers walk in, they are not dealing with something that severe that they have to be admitted. Rather, they would be dealing with something day to day. Okay, stress, mental health issues, now commonly burned out. Family conflicts, acute grief. Okay, so it's not really a acute psychiatric crisis per se. So under that segment, I've heard about this program called Talian Sehat. So can you advise us on what is Talian Sehat? Who is it for? And what is it for? Okay, so Talian Sehat is actually Talia is a hotline, mental health hotline under the Selangor state government. It was established actually in 2021. So it's already been around 5 years. 5 years? Yeah, around 5 years that we've actually had this hotline. That actually caters to just everyday people. Actually, it doesn't just cater to Selangorians. The hotline is an open access hotline. So actually from anywhere, from Kelantan to Johor Bahru to Kedah, all of these people can actually access the hotline under Talian Sehat. Because we cannot discriminate, right? Because are you not from Selangor? You're answering the call. As long as it's not from 03, you reject. So actually, it's actually for everyone. So the people on the other side of the line is actually licensed counsellors. Okay. So licensed counsellors that go on shifts to actually man the phones and actually answer the phone calls of these people. And the people that actually call, their issues range from very extreme to just very minute, as you've mentioned. It could be stress. It could be stress about assignment. It could be stress about homework. It could be just, parental stress as well. And actually, they just need someone to listen to them. They just need someone to listen to them on the other side of the line, whether it be like a big problem or a small problem. It could be a big problem for them. So they just want someone to talk to. And actually, I have actually personally tried calling the Talian Sehat. Actually, the phone call only ranges to around 5 to 10 minutes. You just need someone to sort of meditate or ground you and tell you like what to say for that 5 to 10 minutes and you hopefully be okay after that. But again, if you need a follow-up, then you can still call the Talian Sehat.
Okay, so the operation hours for the Talian Sehat, is it 24 hours?
No, it's not.
Okay, so what is its operation time?
So it's office hours, so 8:30 to 4:30, because like I mentioned, we have licensed counselors doing shifts to man the phone lines, and because of limited resources and limited manpower, we aren't able to do it 24 hours. Like, for example, the Talian HEAL, the federal government hotline, that one is 24 hours.
Yeah. So what happens if they call after office hours or on a weekend? Is it documented that you can follow up the calls later?
Yes. So actually, we are building a feature on the SELangkah app that they can actually text their issues through a chat box. And they can actually tell the person like the summary of what their issue is, and they will call on the next day.
Absolutely. So it's a well thought of solution for acute mental health related matters. But you don't have to label it as a mental health issue. If you're having an acute breakdown, if you're having anything that you think you need someone to talk to, feel free to access Talian Sehat.
Yes.
Okay, so there's 2 numbers that's given, okay, but we'll verify this and put it on the comment section later. 1782-7536 or 1782-7537. And this is toll-free helpline.
Toll-free.
So it's entirely FOC. You don't have to spend calling in.
Yeah.
So based on the data that's given, okay, from our research, those who has been calling the state number frequently has been those who are below the age of 40 and majority of females, okay? And that's the data we have, but feel free to share if it's otherwise, yeah? Next, we are going into Counsellor Hub. Okay, so Counsellor Hub, again, is another mental health related initiative under the Selangor state government. So who is it for and what is it for?
Again, this Counsellor Hub is also established in 2021. So it kind of like works in parallel to Talian Sehat. The ones that are kind of more introverted, they would go for Talian Sehat. And the ones who would want to speak to a person like face-to-face, they would go for Counsellor Hub. So Counsellor Hub is actually a face-to-face counselling session that you can actually book online through our SELangkah app. And all of our counselling sessions are held in 11 districts across Selangor.
Amazing.
So we have in Pusat Khidmat Pandan Indah, Pusat Khidmat Bandar Utama, Pusat Khidmat Kampung Tungku, in Ijuk as well, Sungai Pelek, and the list goes on lah. So we've actually just reactivated this Counsellor Hub 2 weeks ago. So if you would try to make an appointment earlier this year and were unable to, you can do it now. You can do it now through the SELangkah app, and you can actually meet a licensed counsellor who can guide you through your issues lah, and give you the next best step.
Amazing. So in Counsellor Hub, it's in partnership with Perkama.
Yes, correct.
Yeah. So that means you've got the national counselling bodies supporting this program now across all districts of Selangor. And the counsellors are also certified. Yeah. So based on our research by SBTC, you've got 150 over clients who have registered last year.
Okay.
Yeah. And that's an old number, but it seems to be that this is a running program. This is a program that people are actually accessing. That means, one is they might have barrier accessing that help.
Yeah.
Okay, but here we have people who's actually ready to meet the counsellors face to face, breaking that barrier of stigmatization to mental health. So that's an excellent initiative. And
if I may add as well, the Perkama licensed counsellors that we put into the program are actually they can either be licensed counsellors or practicing counsellors who are soon to be licensed. So they also need credit hours for them to be licensed as well. So actually it's a win-win situation where they need clients and the clients also need counsellors. So actually this is a good intermediary step for them to also gain their license so that they can become counselors.
So those that are not licensed, are they being supervised by a senior counselor? Yes.
Supervised.
So these cases are being discussed at a more senior level, and then the management is given accordingly.
Yeah.
So again, I'm backtracking a bit towards Talian Sehat. So earlier you were saying that in the case that they find that the issue that they brought up during that one particular phone call wasn't addressed, let's say they needed another phone call. Or let's say this is something more severe. Someone is probably suicidal or they've got a risk of self-harm. Then what happens in that case?
So we do have an intervention afterwards.
Okay.
So under the segment, we have Pusat Rawatan Subsidy. So we give subsidies for these people with very extreme cases. They go to a Selangor panel. They go to either like a SELangkah clinic, panel that they can access mental health psychiatrists for them to get medication.
Okay, so they're not. There's no way for them to fall out.
Yeah. I mean, that's the best we can bridge the gap lah. Because some of them do like fall out, as in they say they are very extreme cases, they are very extreme issues, and then we never hear from them again. But the best avenue that we can give them is to advise them to go on this subsidy program.
Understood.
Yeah.
How about Counsellor Hub? Is there any costing involved for your clients?
No, so it's absorbed completely by the state government.
Amazing. So the counsellors are being compensated by the state government.
Yes.
So this is not cheap.
Yes.
Yeah.
But actually, because I think the concern is quite huge, right? The concern is that we cannot...
Mental health is a burden.
Yeah, we cannot ignore it. So actually, the Selangor government actually doubled the allocation from 600,000 last year to around 1.5 million this year to compensate for the manpower, the resources that is needed for this kind of case. Because I think there has to be an emphasis on the counsellor and the licensed counsellor and what they can provide to their clients as well. Because we also don't want to give layman advice.
Yeah, absolutely. So to our listeners out there, if there's anyone who's interested to access into a Counsellor Hub for an appointment, where do they go?
They go to the SELangkah app. So actually on the SELangkah app, after they register, so first of all, the SELangkah app, you need to be a Selangorian, fortunately. So you have to be a Selangorian. And when you verify that Selangor, so that's one of the benefits of being at Selangor. So you register as a member in SELangkah app, and then under the SELangkah app homepage, there will be a mental sehat feature. So under the mental sehat feature, there will be several tabs. So there will be a Counsellor Hub tab, and you can your appointment with your nearest Pusat Khidmat.
So for those who are not from Selangor, Fred North, we have got a federal initiative called
Talian HEAL.
Yeah,
so you can also call Talian HEAL.
Okay, don't worry. Yeah, you've got everyone covered in Malaysia. Malaysia Madani.
Yes.
Okay. So we've got another program now. The third interesting program that I wanted to touch on today as a mental health initiative from the Selangor state government was called the SAPOT program.
Yes,
okay, SAPOT. It's a peer-to-peer matching program. So it's actually Malaysia's first accredited peer support platform. Yeah. So who is it for and what is it for?
So actually this segment, like as opposed to the other two ones, this one is particularly for youth. So I think everyone is well aware of the issue last year in Bandar Utama. And after that issue happened, I think it became a bigger emphasis to focus on the youth and focus on why exactly the youth are the way they are today. So with SAPOT, instead of we giving the counselling sessions to licensed counsellors and talk to the youth, we get youth who have accredited, who have done some practice on psychological first aid and mental health first aid. They are the ones that actually counsel and coach the youth that come to the appointment.
Yeah.
And it's sort of like a youth match, peer-to-peer matching. And so they have similar lived experiences. They understand more like exactly what they are going through, like maybe parents or friends or peer pressure. They understand it more. So that's why we match them to peers as opposed to licensed counselors that may be a bit older than them.
Interesting. So is this it's similar to this concept of pembimbing rakan in the school, the purple.
Yeah, purple uniform. Yeah. Correct. But this is also still, the support program is focused still on Pusat Khidmat. So we are giving the community centers empowerment to to actually get people coming and get the youth to come and empower the area as well. And for them to also meet friends and have that buy-in to also, have socialization. Because I think one of the main issues as well that we are seeing with the youth is isolation.
Yeah.
Right? Isolation, playing with devices for way too long. So this is also a way for them to naturally and organically find friends and share their issues with their friends.
So how does one register to be a support volunteer?
So this support is actually still on our pilot phase. So we are still fixing some bugs. So afterwards, it will be on the SELangkah app for you to register as well.
So what is the age of the youths that you're talking about?
So from 16 to 19. So yeah, from 4 to after they reach college age.
Yeah. So if you think, and this is also available for Selangorian youth.
Yes,
Selangorian youth. So if you think that you're a youth that's helpful, feel free to register once the registration is open for volunteer. And if you think you're a youth who needs help, now you can also register and request for help. Okay, the help would come from your peers themselves.
Yes,
yeah,
correct.
Yeah, so we've got a gap. Okay, we've got a gap because a hotline or a counselor's office would fit adults, would fit probably early adults as well, but not youths. Yeah, youths has a lot of barriers because they prefer someone with lower formality, someone who's been there in that experience. The usual dialogues would be, you don't know what I'm going through. Or, Thai, it was different then, it's different now. You don't understand. So I think this is an excellent program. On that note, you've also got another program called the PLZ support program. Who is that for and what is it for?
Okay, so if the support program is for young adults, teenagers entering young adulthood, this is actually for teenagers. So PLZ support program, we actually enter the schools to actually activate the support program. So we get 14-year-olds to 17-year-olds to enter our PLZ support program through the channeling of pembimbing rakan sebaya. So we choose around 30 to 50 pembimbing rakan sebaya, get them to undergo training, so mental health first aid, psychological first aid, helping hands, all these techniques that they might find useful for their friends. And then we shortlist them and then we give them a PLZ badge. So PLZ badge is sort of like the PLZ program is sort of like a top-up program from PRS because I know the Kementerian...
More superior.
Yes. So like the Kementerian Pendidikan has their PRS module, but we also have our PLZ module to top up those skills. And then after they get the PLZ badge and they become additional PLZ peer, then they can help their friends with the added skills that they learn.
So you say, hey, you PRS, saya PLZ.
Saya lagi atas. So it's like a little level up. Level up.
Do they have a uniform?
No, they don't, but they have a badge.
They have a badge.
Nice. Yeah, they have a badge. And so it's still on the pilot phase right now. So we are doing it in SMK Bandar Utama 3 and SMK Bandar Utama 4.
Amazing. And do you have any success stories in your, it can be anonymous. Any early intervention success stories?
Well, I mean, we just interviewed some of the shortlisted PLZ PRS, the ones that have become PLZ support peers. And they actually said that when they see friends that are like going through something, they actually feel more confident to go to that friend and ask that friend, like, how are you? What's going on? Because I think sometimes the issue with youth or like teenagers is because they don't have the language. They might have the empathetic skill inside them. They might have the sympathetic skills, but they don't know how to say it. They don't know how to express it to their friends. So I think through the PLZ support program, they've actually trained themselves with the language and pass it on to their friends. So they've actually become more confident with the skills that we've given them.
Amazing. So this is an excellent initiative. So it's a very well thought of program. So you've thought of the the adults, then you've thought of the young adults, then you've got the teenager, and you've also got the school cohort. So it looks like the Selangor state government is really focusing into addressing mental health as a major thing right now going on in Malaysia, in Selangor especially. Okay, so based on your experience, you were saying that you are running this for quite some time now. You're involved in this for some time. What is the biggest misconception that our community has out there in accessing help through these excellent programs?
I think the biggest misconception is that they think the resources are not available. Whereas I think coming from someone who works on this on a day-to-day basis, the resources are there and it is available. I think to say that they don't know or they are unsure that the Selangor government is providing what kind of initiatives. Actually, it's just through your mobile phone. Actually, if you just install the SELangkah app, and I'm pretty sure everyone has a phone nowadays, right?
Absolutely.
Everyone has a mobile phone nowadays. So I think it's just about tapping into the people that might not know and then telling other people as well that the resources are available and that we can actually just tell friends, hey, if you're going through something, this is a resource that you can tap into. Because again, it's not just Talian Sehat or Counsellor Hub. We also have like a psycho-education videos just on the app itself. So if you are unsure or if you just want to learn first, you can also go through psycho-education videos because those things are also accredited and those things are also by licensed counselors.
Excellent. We might have listeners who's hesitating right now.
Yeah.
Okay, but they want to access help.
Yeah.
What would be your message to them?
I think it's just about whether you want to hop over the bridge and actually seek for help. Because I think for us, intuitively, you know that you need help. And then it's also just about affirming to yourself and validating to yourself that you do need help and how do we get help. So I think first of all, you can just Google Talian Sehat. Maybe the first step is to just call the hotline because I think you don't even need to say much. Because the licensed counselor will train you and guide you through the questions and maybe provide some answers for you. And I think afterwards, if you feel ready, you can go through the Counsellor Hub. And if you think your case is a bit more severe, then absolutely you can try our rawatan subsidy. Oh, and there's also another initiative through the Selangor radio station, Selangor FM. We actually do have a counsellor that goes at night. I'm not sure what the day is, but that goes at night and talks to people about their issues and actually gives really, really encouraging advice as well. So I think it tries, the Selangor government does try to give like an all-encapsulating initiative, all-encapsulating support for people who might need them.
So how I see this is you can access all these initiatives through your own personal effort. That's number one. But let's say you're a community leader. Let's say you're a Rukun Tetangga leader or you're an NGO leader or you're a political leader and you think that you have a mental health program that requires counselors.
Yeah.
Would they be able to connect to you?
Yes, correct. They are able to connect to us.
Yeah.
They are able to hop on to our Counsellor Hub and probably do a Counsellor Hub counter bergerak. So like a moving Counsellor Hub. In their own like Balai Raya or in their own Rukun Tetangga area. So that I think the only issue is that they have to have a discrete area. That's all.
Yeah. So all you need is a closed room.
Yeah.
Somewhere private.
Yes.
For them to do their counseling session. So how I see it is it can be done in your regular housing area together with other community events. That means you can do it sport-related events. You can also do it with medical camps, dental camps.
Yes.
All these screening clinics out there, mobile screening clinics out there can access this help. Okay?
Correct.
Yeah, so to summarize, okay, correct me if I'm wrong, Talian Sehat is someone to talk to. It's quick. It's accessible. Just a phone call away. And there's no walk-in needed anywhere.
Yes, correct.
Yeah? But it's within the office hours. Okay? Counsellor Hub is a real session with a real counsellor, face-to-face, entirely FOC. Again, Talian Sehat, FOC as well. Okay? SAPOT is an ongoing relationship with someone who gets it. It's your peer. Okay, that means if you're a school goer, it's somebody else who's facing the same thing, but someone who has some training, and they are able to address this, able to help you. Yeah?
Yeah, correct.
Okay, so I've rightfully summarized it.
Yeah, correct.
Yeah. So we will share the contact number for Talian Sehat down in the comment section, as well as the information on Talian HEAL. Okay, we feel that this messaging should go out for everyone, because again, illnesses does not discriminate between states. So
Yeah, correct.
even if you're from Perak or Kedah, okay, whoever who's listening out there, stay tuned. We are here to help.
Yeah.
Thank you from SBTC.
Yes. And if I can just say, one final message.
Go ahead.
Because right now we are only encountering 3 calls per day for Talian Sehat. And I think just to sort of like make it worth the licensed counselor's time as well, and to make it worth the investment that the Selangor government has put into, I think even if you feel that your issues aren't big, you can still call them. You can still call these people, because I think we in ourselves, we might diminish the issue. We might think it's not a big deal. We might think it's not a huge problem. But actually, one thing might lead to another. One thought might lead to another thought. So I think it would be best if you just try to
Nip it in the bud.
Yes, exactly. Nip it in the bud. Try to call Talian Sehat. See if it works. If it doesn't work, it's okay. Can try to find me. give reviews on our service as well.
Yeah.
Because we try our best for the Selangorians.
So we'll tag Kwan Madihah in our platform. So you can feel free to connect to Instagram, TikTok, as well as all the other social media pages.
Yes.
So thank you again from Sihat Beyond the Clinic for joining us today in this podcast session.
Thank you so much.
See you in the next episode.